Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Low-sodium diet for heart failure. Introduction. Your healthcare provider may recommend that you follow a low-sodium diet or a diet low in salt to help control your heart failure. This means you need to limit how much salt you take in every day. Cutting back on sodium can help prevent swelling. It can also make it easier for your heart to pump blood. Eating too much sodium puts you at a higher risk of heart attack, stroke, and kidney disease. This program explains what a low-sodium diet is and points out foods that are high in sodium. It teaches you how to read food labels and offers tips for limiting sodium when eating out. Low-sodium diet. Sodium is an element that makes up salt. Sodium enters the body when you eat foods with added salt or foods that naturally have sodium in them. Eating too much sodium can lead to swelling in the lower legs and belly. Swelling can force your heart to work harder. Eating too much sodium puts you at a higher risk of heart attack, stroke, and kidney disease. Cutting back on sodium can help prevent swelling and make it easier for your heart to pump blood. Most people on a low-sodium diet should take in less than 2,000 milligrams or 2 grams of sodium each day. This is a little less than 1 teaspoon, TSP, of salt. Some people may need to limit their intake even more. Ask your healthcare provider what your sodium limit is. You can reduce sodium by cooking without salt, removing the salt shaker from the table, using fresh herbs, garlic, lemon, pepper, or onion to season your foods, putting a splash of olive oil in the water when boiling pasta, eating fresh vegetables, plain frozen vegetables, or canned vegetables with no added salt. Foods low in sodium include the following if prepared without salt: fresh and frozen vegetables, fresh, frozen, and canned fruit, dried beans, peas, rice, lentils, and pasta, lean meat and poultry, fresh and frozen fish, hot cooked cereal, not instant, and yogurt. Drinks low in sodium include milk or soy milk, club soda and seltzer water, coffee and tea, regular and decaffeinated, fruit drinks, and lemonade. You can find low-salt cookbooks at the library, on the internet, or at a bookstore. Using salt substitutes that contain potassium can cause problems with some heart medications. They may also damage the heart muscle. Check with your healthcare provider or dietitian before using a salt substitute or seasoning mix. Changing your eating habits can be hard at first. Within a few weeks of eating less salt, your taste buds will adjust. Making changes slowly over time can help you succeed. Reading food labels. Read food labels when shopping and cooking. The information on the labels can help you choose items that are low in sodium and track your sodium intake. Sodium is given in milligrams, mg. Serving size is the basis for all values on nutrition labels. A serving on a soup can label may be 1 cup or 1/2 of the can. If you eat the whole can, that is 2 servings. The sodium value would need to be doubled. Check the list of ingredients for salt or high-sodium ingredients such as sodium phosphate, brine, monosodium glutamate, MSG, baking soda, and any other ingredient that has sodium in its name. The following are terms you may see on the label of packaged food: sodium or salt-free, less than 5 milligrams per serving; very low sodium, 35 milligrams or less per serving; low sodium, 140 milligrams or less per serving. If you see the following terms on the label, check the milligrams of sodium. It could still be high. Reduced sodium or less sodium, 25% less sodium than the standard version of the product. Light in sodium, 50% less sodium than the standard version. Unsalted or no salt added. No salt was added during processing. The terms healthy and natural on a food label do not have any specific meaning. Seeing these on the label does not necessarily mean the food is good for you. For example, the food could still be high in sodium.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
How much sodium am I eating? Reading labels is important, but you need to know the amount of sodium in all the foods you eat at every meal and snack. Keep a food diary of the sodium you eat. Here is an example of a typical lunch. 2 slices regular bread, 280 milligrams. 2 ounces low-sodium deli turkey meat, 440 milligrams. 1 tablespoon TBSP low-fat mayonnaise, 120 milligrams. Lettuce and tomato, 0 milligrams. Tossed salad with 1 tablespoon low-sodium dressing, 175 milligrams. Diet pop, 40 milligrams. Total 1,055 milligrams of sodium. Here is an example of a lower sodium lunch. 2 slices thin-sliced 45-calorie bread, 140 milligrams. 2 ounces no-salt-added home-roasted turkey breast, 30 milligrams. Lettuce, tomato, 0 milligrams. Tossed salad with 1/2 tablespoon TBSP olive oil and 1/2 tablespoon balsamic vinegar, 2 milligrams. Water with lemon, 0 milligrams. Total, 172 milligrams of sodium. In this example, the person left out the mayonnaise, roasted their own turkey breast at home, picked the low-calorie bread, used olive oil and vinegar instead of salad dressing, and chose a drink without sodium. This reduced the sodium content from 1,055 milligrams to 172 milligrams. High sodium foods. Protein sources that are high in sodium include canned anchovies, tuna, salmon, and chicken, cheese, cured meat and lunch meat such as bacon, hot dogs, ham, and beef jerky, pickled meat and eggs, smoked meat and fish. Vegetables that are high in sodium include canned vegetables and vegetable juice, jarred and stewed tomatoes and tomato products such as pizza sauce and spaghetti sauce, olives, pickles and pickled vegetables, sauerkraut. Baked items such as biscuits, pancakes, waffles, and flour tortillas are often high in salt. So is boxed biscuit and pancake mix. Other boxed and canned goods high in sodium include baked beans, canned soup, frozen dinners and pot pies, instant hot cereal and pudding, macaroni and cheese. Snack foods that may be high in sodium include chips, crackers, microwave popcorn, pretzels, roasted and salted nuts or seeds. Seasonings with salt in the name are high in sodium, including celery salt, garlic salt, kosher or sea salt, onion salt, seasoning salt. Other seasonings that are high in sodium include bouillon and broth mix, lemon pepper, meat tenderizers, monosodium glutamate, MSG, packaged seasonings. Avoid regular and light soy sauce as well as fish sauce. Limit yourself to 1 tablespoon each day of one of the following items: barbecue sauce, ketchup and mustard, salad dressing, salsa, Worcestershire sauce. Tips for eating out. Whether you are eating out at a restaurant, a friend's house, or attending a party, you can maintain a low-sodium diet if you are careful. This section will cover some tips. 1. At a restaurant, ask the waiter how the food is prepared. Avoid breaded or fried foods, cheese dishes, and casseroles. You can ask the waiter to prepare your meal without salt. 2. You can also ask the waiter to bag half of the entree for later before bringing out the plate. This will help you eat less and consume less sodium. If you can, look at the nutrition facts before ordering to help you pick the best options. 3. Choose restaurants that serve fresh food. Salad bars can be healthy options, but remember to select fresh fruits, vegetables, and eggs that are served in their natural state. Avoid salty foods such as croutons and coleslaw. Use oil and vinegar, lemon juice, and balsamic or raspberry vinegars to dress the salad. 4. Ask for sauces and salad dressings on the side. Dip your fork into the sauce before piercing the food. This will help you eat less of the sauce. 5. Restaurants that serve Asian, Italian, Mexican, and American fare is usually loaded with salt, so use caution when you select your meal. 6. It's best to avoid eating fast food. Even milkshakes and salads can have a lot of hidden sodium. 7. If you plan to eat out for dinner, limit your sodium intake at breakfast and lunch. 8. At a party, eat fresh fruits and raw vegetables. Avoid dips and party spreads. Limiting fluids. Drinking too much fluid can raise your blood pressure and make your heart work harder. If you have heart failure, you may need to limit your fluid intake to 2,000 milliliters per day. Ask your healthcare provider how much fluid you can have each day. Fill a container with the same amount of water as your daily fluid goal. Each time you drink any fluid, pour out the same amount of water from the container. When it is empty, you've met your daily goal. Fluids are anything that is liquid at room temperature: Jell-O, soup, ice cream. Only drink when you feel thirsty. Using a small glass and drinking cold drinks can help you feel satisfied with less fluid. You can keep your mouth moist by rinsing your mouth but not swallowing, chewing sugar-free gum, or sucking on hard candy, a frozen lemon wedge, or ice. Even if you don't need to limit fluids, you may be asked to reduce the amount of alcohol you drink. Too much alcohol damages the heart muscle. Ask your healthcare provider whether you need to limit or avoid alcohol.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Most people on a low-sodium diet should take in less than 2,000 milligrams or 2 grams of sodium each day. Ask your healthcare provider what your sodium limit is. Some people may need to limit their fluid intake to 2,000 milliliters each day. Read food labels to find out the serving size, ingredients, and sodium content. Make a list of low-sodium items and put them on your shopping list. Choose fresh or frozen vegetables, which tend to be low in sodium. Avoid vegetables or meals in sauces, such as au gratin, as these are high in sodium. At a restaurant, ask the waiter how the food is prepared. Avoid breaded or fried foods, cheese dishes, and casseroles. You can ask the waiter to prepare your meal without salt. Keep a food diary to make it easier to track the amount of sodium you are eating. This will help you learn to substitute foods that are higher in sodium with lower sodium options. Changing your eating habits can be hard at first. Within a few weeks of eating less salt, your taste buds will adjust. Making changes slowly over time can help you succeed.
Thank you for using Explain.